Welcome. In this video, I'm going to talk a little bit about stroke imaging and what happens in radiology for patients who've experienced a stroke. Basically, a stroke is also known as a cerebrovascular accident. It's a situation where blood flow to the brain is reduced, usually by a blood clot, and it can happen in the carotid arteries, which are in the neck, or anywhere in the branches as they go into the brain. So there are three types of stroke, and we should all be familiar with the symptoms of a stroke, which may include weakness in one side of the body, in one arm or one leg, and you might also see like a half smile, where they can only use one side of the face for their facial expressions. So in a case of a stroke, there are three types of stroke that we often see, and the first is the ischemic stroke, which is the most common type and due to the blocked artery, as I mentioned earlier. And that will reduce blood flow to that side of the brain, and those neurons will start dying usually within minutes. So this is why stroke imaging, stroke treatment is very critical for a timely diagnosis and treatment. The second type is called a hemorrhagic stroke, and that is where it's caused by a burst blood vessel in the brain, and when you have that bleed, that's the hemorrhage part of it, and the stroke is because since the blood is pooling in this little bleed, it's not getting to the other areas around it, so therefore you're going to have the neurons die from lack of blood getting to the needed areas. And the third type is called a transient ischemic attack, which is a TIA. This is also known as a mini stroke, and typically what happens is the patient will have symptoms like a typical stroke patient would have, with the unilateral weakness or facial paralysis, unilateral facial paralysis, and then they will suddenly recover. So that is a temporary kind of a mini stroke or a temporary stroke, and actually it should not be ignored because it may show that patient and that patient's family that there's something significant that could become a real stroke later down in the future, and should be treated, should be investigated and treated if there is a narrowing that exists at the time of that TIA. Typically, the imaging that is done for TIAs is the same imaging, the CT scans, the MRIs, and I'll talk about that. But that imaging is almost always normal because it's something that has resolved by the time the patient has gotten to the ER and has gotten imaging for that condition. So we have several main modalities which we use, and the first and most common is CT scan or computed tomography. That is a CT scanner, as many of you will know. It provides very clear images through, the brain, and you can look at the different slices and see, if there's a problem with swelling in one area of the brain, or if there's a bleed. In the case of a hemorrhagic stroke, you might see that. The other modality that you can do is MRI, which is magnetic resonance imaging, and that can also show you areas of brain swelling that can accompany a neuronal death or neuronal ischemia, where the blood is just not getting there, so the cells start swelling up. And then the other main modality is the CTA and MRA, which is CT angiography and MR angiography. That will show you actually pictures of the blood vessels going into the head and going in from the neck into the brain, and you might be able to catch a picture of an area of narrowing, which is where the stroke is arising from. The other lesser common imaging studies are the carotid ultrasounds, which again are ultrasound study looking at just the neck arteries, the carotid arteries, and it will show you areas of narrowing if they exist. Now, just because if it's negative doesn't mean that there isn't a problem. It just means that the carotid arteries are clean, but the narrowing may be up inside the skull, which you're not going to see on ultrasound. So you have to do the CTA or MRA for that evaluation. And the other thing was the echocardiogram, which is taking an ultrasound image of the heart to see if there's blood clots that are sometimes hanging around in the heart, and then they can get flipped off as the blood pumps. It can throw the thrombi up and start setting clots off. So that's the basics of imaging for stroke patients. I'll provide more detail about and I'll actually show you examples of that in upcoming videos. If you like this content, please give me a like and leave a comment. Thank you so much. Talk to you later. Bye.